Hi, welcome to Nursing Perspective. My name is Brenda Reep Thompson, and today I'd like to talk about the third leading cause of death in the United States. The first cause is heart disease. Cancer is the second leading cause. The third was respiratory disease, but this has been surpassed by medical errors. Yes, medical errors are now the third cause of death in the United States. Approximately 250,000 people die annually from medical errors. Errors can include incorrect patient identification, incorrect medication, dose of medication, mistakes during surgery. Here's another interesting fact. During autopsies, it has been discovered that some patients were incorrectly diagnosed. Now, this week is Patient Safety Awareness Week, so I would like to provide some tips for improved healthcare. How can you avoid being a victim of medical errors? You can make a difference by becoming actively involved in your own healthcare, and I'm going to tell you how to do it. So I have a list of some things that I'm going to discuss. Number one, be sure that your identification is checked, especially prior to diagnostic tests and procedures. The second one is drugs. Know what drugs you're taking. Keep an updated list that includes prescription, over-the-counter medications, vitamins, herbal supplements. If you receive medication in the hospital or from an outpatient pharmacy that does not look familiar, ask for additional information before taking the drug. Next, let's talk about diagnosis. Here's an example. An elderly patient goes to the doctor with a cough. The patient states, "It's winter, all my buddies are coughing, now I'm coughing." So, after a multitude of questions, findings include that the patient is coughing up rust-colored sputum, has shortness of breath, and has no appetite. Now, these additional symptoms entirely change the focus to something that's much more serious. So, be sure to provide clear and concise information. Many illnesses have similar symptoms. Next, we're going to talk about test results. If you have blood work or diagnostic tests, don't assume no news is good news. If you don't receive results of the test, follow up and find out exactly what the results mean and if the test needs to be repeated. It's very important to educate yourself about your condition. Ask your healthcare provider, when should I start to feel better? What should I do if I feel worse? Listen to everything your healthcare provider tells you about your medical condition and treatment plan. Ask questions if you don't understand. Now, if you have a gut feeling that something isn't right, trust yourself. It's okay to get another medical opinion. As a nurse, I urge you to be aware, be informed, be an advocate for your own health care.